therapy and work. So they have been off for 5 months. I've got a firefighter who's tore his rotator cuff. He's done surgery. He's had, 3 times a week for 10 weeks of PT, but he is in crappy shape. He has gained 20 pounds, sluggish, just in really bad physical condition. He has to be able to lift and carry 120 pounds. He has to be able to do stairs. He has to be able to drag bodies. He has to be in really great shape. So our job is we're basically a personal trainer for injured workers. I teach them, they do the same stretches every day, upper body, lower body, core, back, and we'll relate things back to their injury. And then we will work three main workouts. So we'll switch things up every day, so we're not continuously working the same muscle group. Chest, shoulders, triceps, back, biceps, legs, and then a target and functional day. For every hour they're here, they will do 15 minutes of cardio. So if they're here for 4 hours a day, they'll be doing 4 bouts of cardio, whatever it may be, depending on their injury. So it's pretty basic. I'm a really big supporter of being independent, so I will teach them all their stretches and exercises, and then as they get more familiar with the program, they can keep doing it on their own time at the gym. I don't know how many actually do that, but I would love to think all of them do it. I go to the gym more often. So for target and functional day, so for this rotator cuff individual, we'll definitely work the shoulder really hard, and then we'll also do functional tasks. So like if it's a firefighter, I'll have him bring out his turnout gear, so full-fledged boots, overalls, jacket, have him walk on the treadmill, going outside, running stairs, doing like the body drag and pike pull for when they have to check the ceilings. So really functional things to get them more confident to go back to work. I think a lot of them are really scared to go back to work because they got hurt and they don't want to get hurt again. So a lot of them will work on that. Progress them just, they're probably going to be really sore the first week. They're going to, if you go back to the gym, get working out, you hate yourself that first week, but they usually do really well. For lifting protocols, this is a really great way to set goals and to show progression to case managers or doctors or the employer. We will always do a 20-inch waist to lift, which we can kind of show them.
Do you want me to show it?
Yeah. Dana's going to show. So we always do comparative lifts. So 20-inch to waist, 10-inch to waist, and then above a shoulder lift.
20 inches to waist.
So Diana will show.
20 pounds, and the crate weighs 2.5 pounds.
So we'll take baseline measures the first day. So they're all healed. They're
This is 10 inches to waist.
yeah.
I'm doing this one again, because I'm not going to lift all those bars.
Lovely. So we'll set these baselines. We'll have them do all of these things on the first day. They probably won't be they won't have great results because they've been off work for 6 months and they're weak, they're tired. So we just want to set those baselines the first day. And then of course, there's just so many things that you can talk about. You can, when you're making the assessment or you're trying to get them to come back for more work conditioning, then you can justify this person has made all these improvements. They're not meeting their job demands yet, or they are. So just kind of advocating for the exercise. Sure.
When you're setting the baselines, like the 20 inches, are you doing that by how much weight they're lifting, how many times, or they're like, how are you setting the baseline?
One max, one lift.
Okay.
So what's the max? Yes, what's the
So
safe
weight.
max lifting capability? So you just kind of got to use your clinical judgment. If it's a very out of shape person, a very frail person, to start really low, and you just got to use your clinical judgment. But you want to lift to their safe maximum capability. Good question. Yeah. So we will do all of their exercises. I think we usually see work conditioning. So let's talk about a firefighter. I saw him 5 days a week for 3 weeks for 4 hours. He wasn't meeting job demands on his first day. He was lifting maybe 50 pounds, tested him today, and he lifted 101, he met all the job demands, he met everything, we're sending him back to work. So that's kind of what the ideal work conditioning patient would look like. They've done their therapy, they did their training, now they're going back to work safely.